Over the past few years, we've been working with Dr. Branas, who has been studying the impact of the land care program on criminal activity and measures of health. Dr. Branas, can you tell us what your research has found?
Sure. Thanks, Bob, and thanks to all our colleagues at the Pennsylvania Horticultural Society for the opportunity to learn about and study their greening program. Although much of the University of Pennsylvania's attention has focused on the negative economic impacts of vacant space, more recently, and very importantly, we've begun to consider the health and safety impacts of these blighted and abandoned properties. Next slide, please. This recent direction at Penn is part of a larger effort to explore structural and place-based interventions as solutions to the nation's most pressing health problems. The quote here from people at UC Berkeley brings to light an important advantage of such place-based programs, that they can potentially touch more people and for longer periods of time than other programs that focus solely on individuals or lifestyle modifications. In some ways, this is a, quote, old-school public health approach that traces back to a time in the U.S. when public health officials and city planners worked closely together to engineer safe and healthy places. Hopefully some of you have had the chance to see the currently running PBS series, Designing Healthy Communities, which is evidence, in my opinion, that we are in the midst of a much-needed renaissance in which public health and planning are again working together hand in glove for healthy and vibrant urban communities. Next slide, please. It was with this in mind several years ago that we undertook several preliminary studies showing that vacant properties were of great concern, both numerically, but also in terms of the many people in the Philadelphia community who were exposed to these aesthetic eyesores every day on their way to work or school or worse, right outside their homes. But we wanted to do more than just describe this problem. We wanted to see what would happen if someone actually intervened. So together with the PHS and the City of Philadelphia, our team of epidemiologists, criminologists, anthropologists, economists, and community members were pleased to have the opportunity to evaluate the health and safety impact of the PHS land care program. We did this for a full decade of the program as part of what's called a quasi-experimental study in which almost 4,500 vacant lots that received the greening treatment were each matched to 3 randomly selected control lots that did not receive the greening treatment but could have over the same period. The almost 4,500 lots that were greened by PHS totaled nearly 8 million square feet of space and were comparably distributed across the 4 sections of Philadelphia that we studied. Next slide, please. The health and safety effects of greening vacant lots were striking. Most noticeably, we found statistically significant reductions in gun assaults across the city tied to the greening. The green lots may have signaled that someone in the community cared and was watching over the space in question, or maybe more clearly, as Bob mentioned, the newly green lots also may have no longer served as havens, storage grounds, or disposal points for illegal guns, an explanation that was relayed to us time and again by people in the neighborhoods themselves. For select sections of Philadelphia, we also found statistically significant changes in vandalism, high stress, and exercise that were tied to the greening. Next slide, please. We are confident in recommending the PHS vacant lot greening program as a very promising health and safety intervention for Philadelphia and other cities. In all, the greening of heavily blighted vacant urban lots was inexpensive, easily scalable, and tied to significant improvements in important crimes and health indicators. This program is especially valuable given that the U.S. still has tens of millions of vacant and abandoned properties. Again, with our colleagues at the Pennsylvania Horticultural Society and the City of Philadelphia, we at UPenn are now conducting an actual community-based trial with the random assignment of greening to hundreds of vacant lots and control lots that still dot the Philadelphia landscape. Stay tuned for the results of this randomized control trial in the years to come. We are also now studying other structural or place-based interventions as potential interventions that can similarly affect large groups of people in sustainable, inexpensive, and long-term ways. Next slide, please. I'm going to leave you with this photo that captures the intense visual shift in the vacant spaces we've been discussing before and after they've been greened. For those of you who want all the details of our study, as was mentioned, the reference from the American Journal of Epidemiology is below, and we're happy to provide copies of the article to you via email if you can't access it online. Thanks to the Assistant Secretary, the Deputy Assistant Secretary, the Region 3 Director, and ODPHP for the opportunity to speak with you today. We're happy to take your questions.
Thank you, Dr. Coe, Dr. Paxman, Mr. Grossman, and Dr. Branas for your very informative presentation. I invite participants who have not already done so to send their questions through the WebEx Q&A feature. Meanwhile, you will be prompted to fill out a survey about your experience with this webinar. We encourage you to complete the survey so that we can improve future webinars in our series. Thank you in advance for your feedback. We already have a few questions here. The first one for you, Dr. Branas. Does your evaluation examine whether crime is being pushed into other parts of the city?
It does not specifically examine that. However, we did many of our metrics for crime at different levels of aggregation, ranging from the block level up to the census tract level up to the square mile around the lot level. And for the findings that I'm reporting to you here that are statistically significant, they were statistically significant by all those metrics of differing sizes, the largest of which certainly would capture crime being pushed around the corner.
Thank you, Dr. Branas. We have another question. What is the connection between reducing gun assaults and preventing homicides? And that's one we can take here. More than two-thirds of homicides are caused by the discharge of firearms. Organizations and programs that focus on preventing gun assaults, in turn, work to reduce homicides. I believe that's all the time we have today for question and answer. Let me thank you for joining today's webinar. This webinar is part of a series, and we hope you will continue to join us. Follow us on Twitter or join the Healthy People 2020 group on LinkedIn to continue the conversation on this and other LHI topics, and to learn more about LHIs in general. To receive notices about upcoming events, please sign up for our email announcements on the Healthy People website. That is healthypeople.gov. We will be hosting the 2012 National Health Promotion Summit, Prevention, Promotion, Progress, April 10th and 11th in Washington, D.C. You can find more details about that summit on our website. On behalf of HHS, I'd like to say thank you to today's presenters and to everyone who's been involved with planning and implementing Healthy People 2020.